Hi, I'm Alan Roberts. I'm the Managing Director of AMC and have been conducting courses for overseas doctors for many years and also working with local medical students. But today we'd like to talk about the importance of trial exams and assisting the overseas doctors getting through these exams so they can start work in Australia.
Hi, I'm Kush. I'm the office manager at Allen Roberts. So I've been working for more than 8 years, and one of the role has been to conduct these trial exams to help give the IMGs as much as closer exposure to the real AMC exam, trying to replicate it as much. So we'll talk a bit more about the trial exams as we get a lot of questions about it. How do we run it? What's the duration? What's the timing like? And how is it useful for them to crack this real exam and get one more step closer to achieving their dream jobs here? So, talking out more about the trial exams, how exactly we run them, we try to bring them as close as we can to the real exam, trying to give you as much as exposure as we can to work out on your anxiety and trigger points as you have to on the real exam part, giving you same exposure of 20 stations, 16 stations, OBGYN, psychiatry, physical examination, and 4 rest stations. Trying to simulate the environment, giving you 2 minutes of STEM reading and 8 minutes of performance, along with the feedback straight away after we finish the exam. The written and the verbal feedback lets you know that what is exactly that needs to be worked out. A lot of our candidates do the exams again and again because they get used to that palpitations, get used to switching their cells from one station to another station, for example, switching themselves from OBGYN to psychiatry to physical examination, and coming across different sorts of examiners and different sorts of role players, so which gives them a practice of doing it like the real exam.
So just reinforcing a little bit further about what Kush has said. So they get written feedback. So after each station, there'll be a written feedback on that particular station. What sort of good points that they did during the case, what sort of things that they need to work on during the case. Then after they've got the written feedback, there's a collective session at the end of the trial exam where one of the tutors or one of the examiners will talk about each individual case, where each student who sat the exam will have the opportunity to discuss anything that they didn't understand that went on in their case, what sort of things. If they'll have the written feedback, they'll be able to look at the written feedback, and then they'll be able to discuss with the person who's doing the verbal feedback if they didn't understand what that person said in the written feedback, or if they need further explanation about what went wrong and what didn't go wrong with the trial exam. It also gives them the opportunity to use their communication skills. So they'll be given feedback on their communication skills during the exam as well. I mean, that might be on how to close a case off, that might be on how to introduce themselves to a patient. So all of those things will be discussed. It'll be a very thorough examination where they'll be put under pressure, under exam conditions, and then it'll be the main difference between this and the real exam is that they'll be given feedback on what their performance was like, what they've done well and what they haven't done well.
Let's talk a bit more about the venue and the arrangement that we do to bring it as close as we can to the real exam. So we have a dedicated venue here where the whole floor belongs to Allen Roberts, and we have designated rooms and designated stations. We ask the candidates to come in, walk in, grab their own ID cards where they have their name, their number, and we make them sit in the exam venue room. Then we have a meeting of examiners and role players where they're all oriented that how the exam is going to happen. We try to start it at a fixed duration of time, that's 9:15 a.m. There are sometimes delays because a lot of candidates are flying into Melbourne. So we do it at 3 Bourbon Crescent level 5, and then after the first bell rings, all the candidates are put next to their stations. They are given 2 minutes of STEM reading time and 8 minutes of performance. After another bell, the stations are finished, they are switched to the next stations. So we try to give them the same recitations like the real exam, 3, 13, 8 and 18 are the recitations in the real exam, and we do the same as well. After we finish the whole exam, we give them another half an hour break, and then they are given the verbal feedback. So with Alan Roberts doing the trial exams, which gives you a really close exposure to the real exam, and we've got a very good success rate because the candidates who sit the real exam and they come out, they feel the environment was really close enough because we give you enough exposure to lots of 16 different examiners and 16 different role players, which gives you a lot of stress, anxiety management as well. So that's the reason of doing a trial exam. You go through a lot of different sorts of environments in one go. That's in one exam, 3 hours, 3.5 hours. You're switching from one station to another one, which gives you exposure to different examiners and different environments in which you learn to manage your stress. So when you go in your real exam, it's nothing different. You've already been through the same sort of stress environment. This is where we come handy, and we do provide that sort of support where you need feedback. We give you feedback right after you finish your exam. You have a written feedback as well. You have a doctor explaining to you how it should have been done, how the history would have been done, what should be the differential diagnosis, what was the key point in this case that you missed, why did you fail it. Even if you're thinking that you've done everything correctly, this was the thing that you missed. When you come on the real exam, you don't have answers for it. The trial exams give you that sort of answer that this is what you really need to work on. So we've had a very good success rate. We have a dedicated venue here, and the whole floor belongs to Alan Roberts, where when you enter the reception, you're given an ID card, you've given a venue. After that, we have examiners and role players being oriented that what the tasks are to be done, how is it going to be managed. We have support people supporting you at every station. We have toilets and water dispensers as well, which you can use when you have rest stations. And we have a kitchen as well. If you've brought your lunch, you can heat it up and eat that as well during your half an hour break, just before the feedback and after your exam. So we're trying to provide that support that you really need and that exposure that you need before sitting your real exam. We can understand it's a very costly exam. That's why we have a minimal cost trial exam here, which gives you same sort of simulated environment and in which you work out your stress, and then you can go for your real exam.
Further to what Kush said too, I think it's a terrific opportunity to let the overseas doctor experience the exam under exam conditions, to be able to cope with their stress levels when they're doing the exam. For example, I had one of my best tutors that was tutoring it who sat the exam. When he sat the exam, he made a mess of his first case, which is not unusual because everyone who goes for this exam, even though you might be able to manage your stress levels well, everyone will be nervous. So he was particularly nervous at this case, and he messed it up, and he knew that he messed it up. Unfortunately, he let that messed up first case affect his second case too, which he messed up as well, and he knew that he'd messed it up because he kept thinking back to the first case even though he was doing his second case. So when he got to his third case, the rest station, he was able to collect his thoughts, and then he put all of that behind him, and then he passed all of the other stations from the first rest station on. So my point there is, don't let a bad station affect other stations. It should be, each station should be taken on an individual basis, and that'll be a benefit that you'll get from doing these trial exams. You'll actually experience that. You'll experience those sort of stress levels, and if you mess up a case, you'll learn not to let that affect other cases that you're going to sit, because when you sit this exam, you need to pass 9 stations. Even though you're sitting 16, you need to pass 9. So you can fail a station, or 2 or 3 stations even, and still get through this exam. So it's very important to experience the exam under that sort of pressure to get the real benefit from it.
So why the trial exam is important? Because the real exam is all about role play. The clinical exam is about dealing with the patient with empathy, sympathy, and knowledge, which all the doctors are really good in back in their country when they practice. But when you have to do this exam, there are just certain things that you need to keep in your mind. Within those 8 minutes, you have to give your best knowledge as well, but in a structured way. You would say that I knew all these differential diagnoses, but when I went in the exam, I forgot. This is something that I hear a lot. That is where the trial exam becomes helpful. We have so many candidates who set the real exam and they say that we think if we would have done them more, it would have been beneficial. They come back, they do 4 or 5 different sets of trial exams with us because every time we have different sets. If a person is sitting 6 exams with us, we have 20 to 40 big variety of cases and sets which are quite up to date with the real exam. And they have different cases and the compilations are very close. For example, 5 physical examination cases, 3 OBGYN psych cases, MSc, MMSc, counseling, telepathy, most popular new cases which are coming up nowadays, or which are knowledgeable, which are good for them to learn and how to, for example, there might be prompts in the middle and all of that. So the trial exams gives them practice. With the practice, they become used to the environment, which is very handy when they go in the real exam environment and they can perform there.
And we also have, I've noticed that when people have sat the exam, we've had some people, because we mark our trial exam quite hard, we deliberately do that. So we've had some people when they've sat the exam and they might fail our trial exam, but when they've gone to sit the real AMC exam, they've gone on and passed the real AMC exam, so that they've got so much benefit out of actually having a trial under those harsh conditions, that when they get to the real exam, that they found the benefit from it, and that was enough to enable them to help them to get through the real exam.
For example, helping them with the environment and being ready for the real exam. We always send them an email just before the exam or once they've confirmed with us to dress up professionally and practice the exam in a professional way. So the whole exam is ran really professionally, and we advise them to dress up professionally. If you want to practice, bring your stethoscope. We have all our medical equipments where they're needed, in which room, with the different sizes of gloves and all. So to sanitize their hands, which gives them a practice of how to start a course, how to start it and how to finish it within those 8 minutes. Those 8 minutes 16 times are really hard to keep everything in mind and do it appropriately with the structure, which only comes with practice, which comes with doing more and more such type of trial exams or role plays.
And the other thing, even though it's a trial exam and essentially it's communication exercise as well, but in the cases where you might have to use different procedures, like putting on a collar and cuff for a fractured arm, or you might have to do a test for a urine test. We always put these cases in where you actually have to do that procedure as well. So again, it gives you confidence when you get to the exam and you're expected to do those sort of things in the exam as well. We'll have had the experience of doing them when you're doing this trial exam.
For example, different sorts of examination or different mannequins, like urine dipsticks or examination, breast examination, or if there's a pregnant woman, a fundal height measurement. So all of those things are given a lot of exposure in all the stations.
That's right. We use mannequins. So we have a mannequin with a breast examination. We have mannequin for a pelvic examination. So We have if it needs to be a rectal examination, we've got a mannequin for that.
A newborn baby.
Yeah, we've got all of the mannequins that will be used during the exam, so to make it as real a situation as possible. Another thing is too, all the examiners that we use are doctors that have been through the exam, so they understand the exam situation very well. All of them are doctors that have passed the AMC exam, and many of them have gone on to either specialise or they've all got hospital or general practice experience, but mainly hospital experience. So they're very experienced people, clinicians themselves, who have all been through the process not that long ago themselves. So they understand what the candidate needs. So that's really important for the feedback sessions too, because often in that 2 minutes after the exam, the examiner will take the opportunity to give them some impromptu advice about how they can improve when they're sitting the real exam as well. I want to emphasize that the majority of the exams now are face-to-face. So we were conducting online exams mainly last year, but now the AMC has switched completely to face-to-face, except for maybe half a dozen online exams, which we're still doing one online trial exam for people if they want to try them when they're preparing for the online clinical exam as well. But the majority of our exams will be face-to-face. So we need this. We've got the centre here where we can conduct these trial exams, and people can organise themselves, even if they're interstate or overseas and they're flying in to do the exam. If they can organise themselves to come in a little bit earlier, usually we plan our trial exams in the weeks leading up to the real exams. And so if people can organise themselves, they can book themselves into one of our trial exams. And they need to be well prepared, because our trial exams get full. And our next 3 face-to-face trial exams are completely booked out, and we can't add extra people in. So you need to be well organised to be able to do one of the trial exams.
The upcoming exams are 23rd Feb, 28th Feb, 2nd March, 9th March, 16th March. Few of them are fully booked. That's why we had to put new dates. If you are looking forward to book one, I encourage you to go to the website and go ahead and book one, because they get booked out really soon. We only have reserved 20 slots for each exam which get booked. It's very hard to move the dates to reschedule them. That's why they get booked quite often. So we'll attach the link below. You can go ahead and book there.
In a way, I'm really happy that the exams have gone back to face-to-face, because again, you can't just talk your way through, particularly when it gets to a physical examination. You've actually got to do the physical examination. So you've got to examine the abdomen, you've got to examine the chest, or you've got to examine the shoulder or the knee or whatever it is. So you've actually got to do it. So that's where a trial exam will be a big advantage to you, because you'll get that real experience examining the parts of the body that you need to examine before you hit the real exam.
Thanks for watching this short video about the trial exams. I hope it was informative. Please don't forget, if you have any more questions, to comment below or send us an email at admin@rimgasas.com.au. We look forward to all of you and helping you all, being part of our family. For us, all the IMGs are like our own family. We look forward to seeing you and helping you more.